Oh, thank you very much, John. And uh, colleagues, you're most welcome. My name is Daniel Otonge, as Jonas project. So, and we are putting it from the point of view of the earlier workshop that we had, that some of you who are here, like Joyce, Joe himself, and Mondi and others, were participated in and were trained in road safety reporting. We want just to hear from uh, how their experiences have been, and then the opportunity also praise some of you who solutions journalism. So I will be on what solutions journalism 101 is all about, and that would help in whetting your appetite about solutions journalism.
If you can please reconnect.
Hey, John, yes, I can hear you.
Okay, because I couldn't hear Daniel. I think
he dropped off. Yeah.
let me check if okay. Yeah, so I think we can give him maybe 1 minute. I think he should be able to reconnect. Yeah, and then afterwards, I mean, in a short while, I'll share a Google document on the chat box where I will ask that you can write our names and then our contacts and our media houses for registration. So I'll share that in a short while on the chat box. So please, once I share, kindly introduce yourself through that Google Doc. So in the meantime, let me reach Daniel. Yeah, so colleagues, Daniel is reconnecting, so we should have him in a short while, and then we can continue. And for those who have joined, my name is John Muchangi. I'll be your host, your moderator today. Our host, Science Africa. So as we said in the beginning, we had a training for journalists on road safety, which took place in Nairobi late this year. And we have 4 journalists from Kenya who are trained on road safety, and we also had journalists from Ethiopia and from Ghana. So today meeting is to look back into the training we had, and also potentially interest you on road safety training. Reporting, because in Kenya every year we lose about the recorded number of people we lose through road crashes is 4,000. But when you look at the entire time, those who die in the those who die maybe several weeks. Actually, every year is about 12,000 Kenyans who we lose through road crashes. So this is an important topic for Kenya, and especially we are headed to the high season of holidays, when most of road accidents happen, road crashes. Sorry, and I hope through our work we can be able to at least help prevent some of these road crashes. So we'll take probably 1 to 2 hours, and I will hope you can all stay on. So when Daniel comes, we'll have introduction from our host, Science Africa, and then shortly after that we'll have our 4 Kenyan journalists who were trained on road safety this year to give us their experience reporting on this. They were given grants to do in-depth road safety stories, so they will give us their experiences, and then after that we'll have Daniel back. He will take us through solutions journalism, because we do not want to report our stories on just saying how many people have died, but also we want to highlight the solutions and how we probably can learn from some countries that have implemented some of these solutions. For instance, Ethiopia has put up huge pedestrian walks on their highways in the city, on their roads in the city, Addis Ababa. So these are some of the solutions that we have. And then after that, we'll have Matthew Taylor from Communications, Safety and Mobility at the World Health Organization. So he will talk about covering road safety from safe system angles. And then after that, we'll have some remarks, your recommendations. We hope we can have this training even more frequently. For now, we've been having this training once every year. Some of us were trained last year but one. We hope soon also next year we can have more trainings for many of you to be trained, and also to receive grants to do in-depth stories. Yeah, so thank you. And
Yes, John, I'm back.
Daniel, welcome back.
Thank you. Thank you. And sorry, colleagues, about my internet just terminated suddenly. I don't want to take much time. John has explained everything. We just welcome you as Science Africa to this webinar. And we are going to do exactly what John has said. And therefore, John, back to you so that you continue the program.
Just a quick one, Daniel.
Go ahead.
Yes,
as
Leo,
they
please
give
go
their
ahead.
contacts, can they also give their telephone numbers and email addresses?
Yes, thank you, Leo. So I'll share a list, and as Leo has said, there will be a section for your name, your telephone number, and your email address and media house. So please kindly fill this document. So to begin with, I want to ask for introduction from Science Africa, Mr. Leo, and anyone else from Science Africa.
Hello, good morning, everyone. Thank you, John. Thank you, Daniel. And I'm Leo Ogwago of Science Africa. I'm sure you can see I've interacted with quite a number of those who have joined. But at this point, I would want to welcome you and thank you sincerely for having time to join, and hope that you will stay during the whole time. Thank you and feel welcome.
Thank you so much, Mr. Leo. Is Mr. Otula Owuor in the meeting?
Yes, Mr. Otula is here.
Okay.
Thank you very much, everybody. I'm really impressed when I look at the numbers. I think something is working right. Journalists are beginning to go in directions which we used to ignore, like this one we are dealing with on road crashes. It just used to be police reports, finished. 2 people died, accident, finished. But now it's a major thing for Africa. And I can only say I'm happy to see this number of people. And I hope that from presentations and consultations, you'll do stories that will be effective based on solutions. Otherwise, you're welcome, and we are happy to have all you here. And not just on Thank you very much.
Thank you you very much, Mr. Owo.
Thank you, John team.
Thank you. And is Matt on the call?
Not yet. Matt will join at 11.
Okay. Okay, fine. Anyone else from Science Africa? From the technical
I think
team?
that's it. Unless, Tony, you have an announcement to make.
Maybe you can write your email via chat, so we can also take notes for your emails and contacts via chat.
Thank you very much. Sorry. So to go straight ahead, I want to introduce our 4 journalists who have been working on road safety stories. And just to ask the team here who are attending, do you know we don't say road accidents anymore? I see most of our reporting, actually, when we look at the reporting in Kenya, yeah, most of our reporting is 10 people die in a road accident, 4 people injured in road accident. We don't use this word accident, and we will get to know why. The word we prefer, the preferred word is road crashes, and we'll get to know why in a short while. So I want to invite, we have 4 journalists who will share their experiences briefly. We have Joyce Chimbi, and we have Chris Omondi, and James Wanzala, and Chebet. So first, I'll ask Joyce Chimbi to introduce herself and tell us about her story and her experience reporting on road safety. And then after that, we'll go to the next journalist. Welcome, Joyce.
Thank you very much, John, for the opportunity to share about my experiences. My name is Joyce Chimbi. I am a reporter based in Nairobi, Kenya. I report for both local and regional media platforms. And my experience is reporting on road safety started. Otula left off. Otula said that it's very, very interesting to see how journalists are moving from just reporting about the crashes, that there's been a crash and this number of people were injured or this number of people died, and to more complex issues of road safety. So when I first joined the training, I did not understand, I mean, what else is there to report about, apart from the road crashes? So it seemed to me at that time that reporting on these issues is a very, very narrowed, angled kind of media reporting, because you only look at the issues when there's a crash. But I've since learned that there's a lot to unpack. First, starting with the language. When we talk about road safety, what are we talking about? When you talk about road crashes, what are we really talking about? Because even as we do the solution stories that we learned during the training, I realized that it's the first thing that we need to do is to really understand the issues around road safety within our localities and also at the regional level. So it's been an eye-opener for me, and also networking with the colleagues from Kenya and also from across the region. So first for me has been to learn. And I've been quite, impressed to see the amount of information that is out there from WHO and other relevant stakeholders, including NTSA and even around policy issues. So just learning first before even addressing road safety as a solution-oriented issue has been the first step for me. And the trainings were in-depth. We got to do a deep dive across all the issues that you could think about that pertains to road safety, transportation, pedestrians, motorists, and all the languages and the words that go into that. So that has been quite interesting. So to go into my story, the pitching process was not all that easy for me, because remember that as journalists, I'm sure most of you would agree that we don't really look at road safety broadly. We usually look at it as, there's been something has happened on this road, and this number of people have died, this number of people have been injured. So finding solutions was not easy. And I did find a solution, and it was an intervention that was started by the previous regime, previous government. It's around unique identifiers for the Boda Boda sector. And again, going back to the problems, I think we've all associated the Boda Boda sector with the problems, and unruly and uncontrollable, and a lot of crimes. And looking at them as solutions oriented and having a solutions that pertains to the Boda Boda sector was quite interesting for me. So it first started with the government trying to get everybody who operates as a Boda Boda to be registered, to have biometrics so that they can be easily traced. Because if you're able to trace them, then it's easy to control the sector. So I found these unique identifiers where you register with a SACCO, and then you're given a unique number. So if I see you with a reflector jacket that has, say, number 097, around, say, Kilimani area or whichever area you find the intervention, it's easy even for the police in the area, the police station around that area, to identify that person just based on that number. You don't even have to know the name or see the name. Just giving the police that number, you're able to identify who they are. So once the previous regime left and the new one came on, the intervention stalled because every regime has its own priorities. So it hasn't been shelved. It's ongoing, but not at the pace at which it started. But what is interesting about the intervention is that the Boda Boda sector decided to continue with it because it's in their best interest for them to have some kind of credibility and legitimacy, so that people don't look at them as this rogue and this criminal sector. So they've been doing this intervention, and for a long time, when you see a reflector jacket that is blue, green, they have all different colors. It doesn't communicate anything. They say a lot within the sector. They understand so that has been interesting to see what the sector has done, because I love community-driven initiatives because they are very sustainable and they are often low. Because even within this intervention, all you need to do is to register with a SACCO, to pay a very small fee, and they'll give you the reflector jacket. And also to look at, do they understand what WHO says about lifting in terms of even the protective gear that they use. So all that has been an eye-opener. I spent a lot of time in the field, and I spoke to a lot of people. I even spoke to people from the law enforcement. So there's a lot that's going on within our communities around road safety. So it's upon us as journalists to find these solutions. And somebody told me during the training we had with Science Africa, because I was asking, how do you find these solutions? Are there tips on how to find solutions? And they told me, solutions are everywhere. And since the training, indeed, I've been seeing solutions everywhere. So mine is really thank you very much to the team at Science Africa, and also the partnership with WHO, and for having given me this opportunity to learn and to expand my knowledge around these issues, and also to advance my reporting on road safety. So thank you very, very much, and back to you, John.
Thank you very much, Joyce. And it's interesting to see that road safety is not only about this. There's so much we can report on as journalists. So next time I'm going to call, I don't know whether Emily Chebet from Citizen TV is online and ready. Emily Chebet. So in that, then as Emily gets ready, I'll call Chris Omondi from KBC.
Yes, John, thank you. Is
Yeah,
it to
Chris,
turn on my
go
video?
ahead.
Or that's fine?
If you wish, we'll be happy to see you. We only see you on TV. We want to see you live.
Okay, that is the
You
case.
have 10 minutes.
Yeah, I'll use that time, and I want to share my experience reporting on road safety. And first, my name is Prince Omondi. I work with the Kenya Broadcasting Corporation. And I must also say that I'm one of the pioneer solution journalists in Kenya, having got the training 2020. That is when at the week of COVID-19. And a lot of things have changed in terms of on a daily basis, and just looking at the solution-oriented stories has actually shaped a lot of our reporting from then. And before I go to my experience, I want to thank very much SANS Africa and the World Health Organization for this opportunity, and also for today for also allowing us to invite our colleagues to be part of this training day, this webinar. Because that such meetings is where we can actually share more and also do a lot of networking. Back to my story, I was one of the 4 Kenyans who were trained and also got grant to do stories on road safety. And I looked at a lot of things in the first angle of actually pitching, because we were told to pitch, and looking at how the road safety stories have not been really reported much in the Kenyan context. The pitching bit was the one that was had a lot of work for me, because I got into a lot of research to just look at how do I get out a story that has been underreported in our context. Now I went to, for some data here. The data that I got from the National Transport and Safety Authority in Kenya. That John said that the difference between road accidents and road crashes, and the difference, of course, is clear there. It's only to realize that what we have been conditioned to that Ajali got interested in this because what we know on mostly is the number of 1,000 who have lost their lives. But in this data, we're talking about 7,000 people involved in crashes. I asked myself that where are the 6,000? Why do we talk much about the 1,000 and then don't talk about the 6,000? Because you realize that even if there is an accident and one person has, there is a crash and one person has lost his or her life, then could be if you go and talk about that in your newsroom, they say that that is not news. We want to hear 10 people, 15 or even 50 people, so that if it's one person, then they don't talk about it. So that is where my story came from. That where are the 6? I asked myself that question, and then my story angle now went to the post-crash care. Now, the post-crash care that I was looking at is what happens to people who get involved road crashes and then die. What happened to them at that scene? What happened to them even in the hospital? So that is what I looked at, and I gave my story a title. The story title was Boda Boda First Responders, Saving Lives on Kenyan Roads. That is the title of the story. So in this story, I went deep into looking at the solution and the story of first responders. And from the statistics in Kenya, there are between 1.2 million to 3 million Boda Boda riders in Kenya. And those Boda Boda riders, in every scene, according to the evidence that is there, you will get a Boda Boda operator. If there is any crash scene, you will get Boda Boda riders there, trying to help, trying to do 1, 2, 3. But again, because they don't have the skills, they end up compounding even the those who are involved in the road crashes. They go with the good intention of helping, but then they compound because they don't have those skills. Now, this is when I went out and looked at what is happening. Is there anything that is already rolled out? And is there evidence that this thing is working? Yes, that is what I found, that the Kenyan government, in partnership with St. John Ambulance, are actually doing trainings for Boda Boda riders on first aid. And that training is a training that is given around 5 days. Every day, like you go every Monday. Today is Wednesday. If you go every Monday, like next Monday, the headquarters of John Ambulance, they're enrolling every a group of who are being trained on first aid skills. So the training takes place for almost a week. And then when you go back now as a boda operator, you have the skills and also even get an opportunity to have the first aid kit, which help them to actually help the post-crash care. This is what went out in some of these training when they were doing the trainings and had first-hand experience in how they're trained on road safety and also helping victims of crashes in doing the post-crash care. And also got testimonies from the boda riders who have actually used their skills in responding in the road crashes, and realize that it is a story that has not been reported. It's a story that has been underreported, and it is something that can really help to improve the road safety and also improve the post-crash care in Kenya, because I've told you about the number of boda riders in Kenya. Actually, boda is the most popular now means of transport in Kenya, because it's between 1.2 to 3 million according to the data from Kenya today. And that is something that we can use. Then so the numbers can be used for the advantage of improving the road safety. Now, from my reporting entirely, I also realized that the solution-oriented stories on road reporting has not been there for a long time. You realize that even if you look at the headlines, you'll only see that 10 people lose their lives, or Kenya is doing this and this. But we have not gone out to look at the initiative, most of the initiatives that are helping actually bring these numbers down. Yes. So that is what I don't know why there's some feedback. Anyway, that is what I worked on, and it was interesting to come up with a story, the solution-oriented story, and the solution that I was talking about, the post-crash care, that I think that most of our colleagues here will also carry on with and see that the more we look at the people who lose their lives and forget about the thousands of people who are involved in crashes, then we are not get right. But if you look at it, like if you're talking about 7,000 people involved in road crashes, 1,000 losing their lives, and what happens with 6,000? So that is what I followed up and realized that the post-crash care that is actually happening now by the boda riders through trainings on first aid skills, the Kenyan government Institute of Transport, and also the St. John Ambulance is actually bearing some fruit, and there is testimonies of how the life-saving opportunities on road or Kenyan roads is happening, and testimonies from the boda riders of how they have helped their colleagues or even other people who are not boda riders whom have also benefited from this, is something that made it was a cornerstone in my story of boda responders saving lives on Kenyan roads. So that is what I managed to come out with, and I want to thank all the stakeholders, the Sans Africa, World Health Organizations, even our colleagues who helped in producing this story. Thank you very much.
Thank you very much, Chris. I think afterwards we will share through the emails you've given us. We will share some of these stories. Like Chris has said, our story is mostly focused on those who have died. But what about those who survive with accidents? What to do if a crash happens near where you are? What are you supposed to do? How can you help, or how can you support? And also in terms of policy, in South Africa they have a fund that supports people who have maybe been maimed through road crashes, or the families that have been left. So is that something that Kenya can explore? So these are some of the solutions that we can think of. And thank you so much, Chris. So next we're going to have Emily Chebet from Citizens TV. She was also one of the trainees and also produced a story. So Emily, you're most welcome. And then after Emily, we'll finish with James Wanzala from Standard Media Group. And James is actually an advocate on road safety, especially on sidewalks in Kenya. Thank you. And Emily, welcome.
All right. I don't know whether you can hear me, but
yes,
sorry, I joined
loud and clear. We can hear you.
Okay. Okay. I joined it. I had a quick office meeting. But good morning, everyone. First of all, thank you so much for the opportunity just to talk about road safety. And just to go straight to it, because I understand we have very limited time, is that let me just thank, first of all, South Africa and WHO for bringing us together last year to talk about and also to get trainings on the same. Because prior to that, I had not seen something different or positive to talk about when it comes to road safety and road crashes. And even right now, what I can say is that we are still struggling as a country, even if we look at so that time I was just sampling and looking at how we've been covering road safety issues. And if you look at it, majority of our stories, quite a number, is just talking about accidents, and especially when more than 3 people died, that is when we cover. And you see that the lead, or what we call the top stories of the day. It will be a family losing 3, 6, 8. So those are stories, and most of the time we cover just because somebody died. And I think my colleague mentioned about what about those who survived. So I think it is a very timely and also good to continue talking about this. So my personal experience actually when I was there's a story actually that I pitched but I abandoned. Reason, you're looking at the solution. You want to see how these people are getting it right. But there's an organization that actually came up with something they are calling emergency care along the roads. But due to 1 or 2 reasons, it is not working. It didn't pick up. And they had some containers along Naivasha where if you have an accident, you rush there. There are doctors, there are medicine, they're supposed to give you first aid, and then they can actually advise whether you're taken to emergency or you're okay, just checking and going home, which is a good thing because it was meant to actually reduce the number of people who are losing their lives on the road. But remember, this country, we have the national government, we have the county government. So the lady who leads that told me that it worked for a very short time before COVID. And then when COVID happened, of course, it like disrupted everything, including that. And people went home for some time. All the doctors and nurses who are supposed to be working there sort of were needed elsewhere. And after that, it has never fixed. The reason? People don't seem to understand the importance of having such emergencies and also how to save lives along the roads. And so she was telling me she's getting a lot of trouble actually getting back because of you need county government on board, you need the police officers, and you need these doctors and nurses so that they can, because you see, you cannot pay these people from the pocket. So the government has to actually look at the importance, and these doctors who are paid would be along those roads attending to people. But because people are not understanding it, it means they see like that's a wasted resource. And so right now it is not working. So that was a story that actually I like hit dead end. And you see, it is something that is working. Is you look at the UK, those are the things that actually reduce the number of people who are dying on the roads because and remember in this country we are still struggling with our healthcare services because even our dispensaries do not even have medicine. Sometimes you rush there, the first aid is not there. So you get an accident along, or that's a road crash along Naivasha, and you're rushed to either Nairobi or Nakuru. So if someone was in a critical condition, you die along the road. So how can you reduce the number of these people? So if we keep telling these stories, and also the policy makers to look at how else, not only to reduce in terms of looking at our vehicles on the road, but also looking at if at all you get into a crash, how can you get that fast and quick response for you to actually improve your chances of survival? So those are the kind of stories that I've experienced after that. And also I'm looking at the goodwill from the political, because this country definitely are the politicians who are making the laws. So what is the political goodwill in terms of implementing and coming up with some of these programs? If we do not get someone who is willing to give their recommendations and also sit down, have meetings, because have public participation and come up with such issues, then we still have a big problem. So currently, as we stand and where we sit as a country, we still do not give priority to road safety issues, and we just call them accidents. And when you call it an accident, it means there's nothing you can do. It means it's something that it will happen anyway because it's an accident. But once we accept, and you see, we have a challenge even in our newsroom, because you write a story and you put the word crash, and the editor will reduce it and call it an accident. So that is the biggest problem. And right now we are trying to see how even our editors can understand that it is not an accident, but rather it's a crash, so that can get a solution to it. So that is where we are at the moment. And another thing that I'm trying to see is that how can we as reporters actually prioritize and do these stories even when there's no crash? Because currently we're just doing it when there's a crash. How can we even just get into sensitization? Because most of the time it is about after. It's something that has already happened. Can we do stories that can actually prevent? Because I remember there was a time, let me just give an example, where some of the officers actually are very willing and ready to give support. And so if we do not give them airtime, and you see, our newsroom, it's about making money. So when you say you want to give them airtime just to talk about something that has not happened again, trying to find a solution to something that it has not been really accepted. But such workshops, and I think after I attended that WHO South Africa thing, it is easy for you to understand how even to angle your story and how to pitch your stories to be accepted. So those are just the experience that I have had when covering these stories. And so probably I don't want to belabor so much, because most of the things that I have mentioned, unless there's a question, but maybe one last observation that I've actually made is that the blame. We really blame people a lot. And actually, even one of us, or say, for example, myself, I get into a crash, and I will be quick to say the other person was the one who caused it. So, as reporters, what do we do, and how can we bring these stories to stop the blaming and actually bring the issue? And also, at the end of the day, we are trying to look at the solution, all of us, and get to the bottom of it and reduce, because the end game is that we reduce the crashes and also the people who are losing their lives out of that. John, I don't know whether I've finished my 10 minutes, but I think in short, that is the experiences that we're going through. But I always say, if we continue telling these stories, it will make more sense to some people, and it will make a lot of change, and will bring change actually in our news. Especially for TV, we have a big problem because of the limited time that we have. So let's find a way of bringing up these stories more and more. Thank you, John.
Thank you so much, Emily, and thanks for highlighting that. Especially, you mentioned a new thing about the blame. When we report on these stories, mostly we blame the driver who was speeding, but as we will see later, there are actually many other factors. Sometimes it's also the road design. Sometimes it's also the authorities that should do inspections for the vehicles. It's so many other factors. So these apportioning blame, even in the way we write stories, is something also we need to look at. And before we go to James, from what Emily and Chris have presented, the statistics show that around 10,000 Kenyans are usually maimed for life. These are people who are disabled physically for life in road crashes every year. So that's a huge number. So actually the burden of road crashes is not only on to do with deaths, but also maiming people for life. And these are people who of course, mostly lose also their source of income. So to finish, I want to welcome James Wanzala. Please, James, you can introduce yourself, and then briefly, please don't exceed 10 minutes, and you share your experience so that we go to the next step. Thank you. Also, I see the form. I understand the form. Many people are not able to edit the form. I'm trying to change the settings so that everyone can be able to register on the form. So please check in like 2 minutes time. You should be able to register. So James Wanzala, please.
And John, as you do that, there's something I actually forgot to mention.
Yes, please.
There's something that I think 2 weeks or 3 weeks ago, a car was burnt, a very brand new car. Reason? The person hit two pedestrians who were crossing the road. So while people are crossing the road, and there are actually there are footbridges, but I have realized in this country that footbridges have been taken over by people who are selling. So it's a market on its own. Those along Muthurwa, it is like a home to those homeless children. So you cannot actually go through, and others are not well lit. So people are not they're not using the footbridges, but they are running along the highways and they are hit by the cars. So if we highlight those stories also, I think it's a way of reducing and looking at and the policies around it. When you're crossing the road and actually you're supposed to pass through a footbridge, what is supposed to happen to you? Because I think there is a clear law on where to cross, when to stand, when to actually pass, and the cars. Sometimes the lights are actually red. You're supposed to be still for people to pass, and then they're rushing around. So those are the kind of stories that I feel like if we bring forth more and more, and then also the authorities to speak about the lawsuit when it comes to when you're caught actually go to jail. What happens to you? Are there laws? That's actually that I feel like it's important.
Thank you so much, Emily. Yeah, and James, when you speak, please also address that. I want to ask the admin to. I think James is having problem unmuting himself. If you could kindly, Rume, if you could unmute James Wanzala.
John, by end.
John.
Yes, please.
As that happened, maybe in a minute, something that I left out, which I feel is important, is Chris.
Yes, Chris from KBC.
From KBC.
Yes,
yeah.
Go ahead.
What I also realized that as I was doing this story is the kind of approach that the policymakers also giving to the road safety in road safety measures. And as our colleagues again will tell as we continue in terms of the solution journalism approach, that one of the countries that is doing very well in the world is a country called Sweden. And Sweden is doing well because of the approach they've taken in road safety. And the government in Sweden, the approach they have is the cars that are involved in few crashes are actually given some bonuses in terms of even tax and a lot of things. So you realize that the cars that come from that end, cars like Volvo, the cars like Scania, the making of those cars does not look much on comfort, but looks much on issues of safety. So that is something, again, that as we do this, I think you can also borrow from what is happening elsewhere. And in terms of the numbers, because somebody, I was asking, like, if we are talking about year in, year out, you realize that maybe if in Kenya this year we have 4,000 people losing their lives, and next year it's 4,200, then is it in the increase? And I realized that there is a new thing there in reporting road crashes and road safety. They talk about it in terms of decreasing at an increasing rate. That if the number of vehicles in Kenya this year were 1.2 million, and we have 7,000 crashes, and next year we go to maybe around 3 million, and then we have 1.2 crashes, then that in reporting does not mean that the number of fatalities increased, but you say the number of fatalities decreased at an increasing rate. So those are some of even the terms that we also need to be conversant with, that as we speak about this, and also look at the numbers vis-a-vis the crashes. Why there are low numbers in Lodwar and more numbers in Nairobi, example. So those are things that I found out when I went to the field. It's that when you go out, you realize that it's an interesting bit to cover, and also just let the people listening or view also know. So I felt that that's something that I also needed to share.
Yeah, thank you so much, Chris. I think that's quite important. Actually, from the discussions, what we see is that this road safety is quite broad. It's actually recognized as one of the non-communicable, part of the non-communicable from the presentations. So this, James, are you able to unmute?
John, we can't hear you.
Okay. Can
John,
can the rest hear me?
We can hear you loud and clear.
Yes, I can hear you.
I think it's probably an issue with
Yes, John, we can hear
his
you.
microphone from his end.
Okay, so maybe I think Daniel, we can go to the next step, and then Wanzala will speak as the end.
Yeah, that's what I want to say. Thank you very much. I think this is going on very well, and the experiences that have been shared. In fact, one of the things you've heard from all those who have talked is that they are not using the word accident. They are using crashes. There's a reason for that, and I think Matt will talk about that because that is what the recommendation that WHO is making after serious research around this subject. So, John, I would suggest that we use maybe another 20 minutes or so or less and ask colleagues who have joined to also share their experiences, because a number of them have also been reporting on road safety issues, road crashes.
Yes.
How have they been reporting this, and how do they relate with what they have had since we started? Maybe people can just randomly raise their hands and share their experiences.
Yes, anyone who has reported on, maybe you reported on road accident, but now we have learned it's a road crash. What has been your experience? I think you can unmute yourself. And also, please, colleague, continue to report on the Google Doc that I have I've shared. It's I think everyone now can have access.
Good morning. My name is Jack Ramina from the Alien Vibe magazine. Now, I mean, I've done a bit of reporting here and there on a bit of article writing rather here and there on the quote unquote accidents or the car crashes. And I would say, I think it's important for us to know that no, it's important. It's actually important to find a way to report on these things, not necessarily after the fact. You can find, especially with the new term you guys have been using frequently this morning, solution reporting. I think it's the best way to, just find a way to talk about, find a way to hold conversations on the same topic, and not really focus on what happened and where, because a lot of times we feel like without the blame, there's really no conversation around it. So I think just finding a better angle to talk about it or raise awareness around it would be great. But other than that, I think this is just a learning experience for me, especially hearing from the last.
Thank you very much, Jack Raminya. Yeah. Clement Masombo, do you want to speak? Anyone else who has had experience, maybe the difficulties you've had reporting on road safety? Feel free to share this point.
Yeah, or a story that you published, the story that you published on road safety. What was about? What was the angle and all that? If you can share, please. I think it's good for learning. John,
Yes, please.
can we move then to the next? Because I can see there is no one who's willing to share the experience.
Yes. Yes, Daniel.
Is James?
James,
are you?
James has just spoken to me. He still has a problem with sound. So I think we can move to the next part of the meeting on Sojo 101 refresher course, situating the 4 pillars of Sojo in our stories.
Okay, let's move to that then. Tony, do I have the right to share?
Yes, you have the right. You can share.
Okay, so let's start by having a show of hand, or just type yes or no if you know or you have heard anything about solutions journalism. Just use the chat to write. I just want to see by yes, I can see yes. Very good. Continue. Okay. Yeah. From what I'm seeing, from the chat, what your reactions? It shows that we have a mixture of people who have heard or know or something at least about solutions journalism, which is good. So it means that we can be able to share, and anyone can come in and explain. I see a number of people who have done this. I'm seeing Sharon here, my colleague. Mr. Tula is here. I'm seeing John. I'm seeing Wanzala. I'm seeing Chebet. I'm seeing Joyce Chimbi and many others that I'm seeing. Ronald, not Ronald, I think I saw Odhiambo from Standard Kisumu. So these are people who have actually learned solutions journalism, and it will be good to share as we speak. We have about 1 hour to do this. So please feel free to jump in if you want to share your experience in terms of a story you've written from solutions journalism angle. I'm going to share a small PowerPoint presentation. Tony, now I can't see it. I don't know where it went. Can I, maybe let me go back to my email, check it. Yeah. Just give me a minute. Thank you. Okay, so here we are. I hope you are able to see my screen.
Yes, we can see your screen.
Okay, so thank you. We want to talk about solutions journalism. This is the solutions journalism 101, and basically we want to define it and also look at what it is not, because that is really important, and then why it is important to write from a solutions point of view. And I believe from what you have heard, what my friend Chris, Joyce, and others, and also Chebet have talked about, you're beginning to see that their approach is to the stories that they are talking about is a bit different from the way we were trained. If you are all trained journalists, the way we were trained to approach journalism, you will see that there is some little difference, and that's the difference that we want to emphasize through solutions journalism approach. And I want to say from the onset that it is an approach to how you do a story. It is not another type of journalism, so to speak. So you do use all the canons of journalism that you know, but use the approach instead of focusing, for example, doing the story in the conventional way. You use a different approach that focuses on the solutions, as we say. So as you can see from the slide before you, there are a number of trends that we see in the media today, and you must have experienced this, that research reports show that most people actually run away from news, from the media. Or why? It's because of the negativity. Because we always mostly report about maybe, for example, deaths on the road, and not following up to report on other issues that your colleagues are talking about. Who is doing anything about these crashes that people want to know? Because people want stories that they can relate with, that can help them solve the problems that they have. Then in the research that was done, you find that a number of people, especially during the COVID period, were forced to avoid, for example, the print papers, for example, and therefore they focused more on the use of other types of media and looking for information that could provide hope. During COVID, for example, it was really a serious time when people were yearning for information that could help them to even survive, literally survive. So because of that, and even if you pick that alone, there are reasons why we, the journalists, need to approach the way we do our business differently. Because now, even the rise of technology is threatening our profession. How do you, therefore, change in a manner that can make you, as a journalist, as a person, relevant, and then translate that also to impact positively the media house that you work for? If you work for yourself, draw more people to your blog, to your online paper, so to speak, or podcast, or whatever it is, based on the kind of information that you're sharing through your media. And that is what led a team of journalists, mostly based in the US, who are also senior journalists, actually, looking at their media environment and what they were doing. And they were wondering why are so many audiences running away from their media houses. Recently, we met with the Nation editors, and they were sharing that no nation is the biggest in East and Central Africa. And if their circulation can dwindle right from the COVID period to just about 15,000 papers, for example, in terms of circulation, that must raise an alarm, and therefore must make you as a journalist or as an editor or as a media manager think that what can I do to change this trend, to reverse this trend? And one of the ways these journalists thought about is to see how you can approach the journalism differently. You know, you maintain the rigor, of course, of the journalism, the canons of journalism that you have, but then the focus of the story is what you make a little bit different. Instead of focusing on the problem, you focus on the responses to social problems that face society. For example, the roads. We know so many people are maimed, so many people die on the roads, so many families are left economically destitute, so many people are left with huge bills. Even as we speak now, if you go across from where I am, just around Lenana Road, there is, as in Nairobi, the spine injury hospital. And if you go there, my friend, you will see the kind of problems that people go through. And not only those people who are bedridden or who are on wheelchairs, but also the families that have to deal with them or pick up the medical bills. So solution journalism is a rigorous evidence-based reporting on responses to social problems. Social problems in this sense is something that I would raise personally to a level of an issue that affects maybe a community as a whole, or a nation, or the globe, something like, for example, climate change, or something like road crashes, which is a global issue that captures the attention of the United Nations, so to speak. So, so it is about reporting on something that is happening now, and that affects people generally. You know, it's not about me helping my colleague or my colleague Tula helping me, and therefore I come and write a story that yes, I helped Mr. Tula, or Mr. Tula helped me. No, it's about what is being done about a social problem, a systemic problem that society or people are grappling with, and what is the impact of that particular response. If you don't come out with anything from the presentation that you're having, please take this slide very seriously and see it. The 4 pillars solutions journalism is what makes all the difference. And they are just 4. One is response. And the response here is to a problem. It focuses on a response to a social problem and on how the response has worked for people. I emphasize responses that have worked. Responses that have not worked do not help people that much, but you can also, talk about them if that particular response can help. Are you able to see where I am?
Yes, we can see your screen, Daniel, on kenyans.co.ke.
Yes, there is responses. So I'm talking about the response, and I was emphasizing that you can also talk about a response approach that has not worked because you would like to point out why it did not work, and then what can be done or what has been done to make it work elsewhere. I think that's important. But in solutions move forward on talking about what is working, not what is not working. Then the second pillar is evidence. In this response, as you write your story, you need to find data and people, the beneficiaries, people who have benefited from this, to tell you whether this response is actually working, so that you can write with certainty that it actually works. That's where evidence is important, and this requires data, correct data, current, and also you get it from the beneficiaries themselves by interviewing them. So you can see it's like any other, the normal way to do journalism, just that your focus is now on the response, looking for the evidence on that it works, that would be able to enable you to say with certainty that this response is actually working for people by the people themselves telling you. And then the fourth pillar, which is very important and usually misses in the stories that we get from a number of journalists that work with in this journey of solutions journalism, is this insight. This is more about giving the details of how that particular response works. How is it done? You give the details. You talk to the experts, both those who are involved and those who are not involved, so that they can give you other perspectives. And then you also talk to the people themselves who are benefiting from this particular response and ask them how it is done if they understand it. Because that would also help you to also include what the limitations of that particular response are. Remember, there is no silver bullet here in terms of response. You can't say, when you do this, then you solve all the problems. So there must be some challenges that are involved in terms of what is being done about that particular problem. So that is what we call the limitations, which is the fourth limb of solutions journalism, or pillar. Do we have any question around that? Anybody with a question, please just raise your hand, or just speak. John, help me if you can see any. If you can see any hand up, I'll stop sharing a bit so that you can see if there's any interaction. Any question on the 4 pillars? Any emphasis? John, do you see any hand?
Sorry, Daniel, I think I missed the last part.
Yeah, I was asking if there is any comment, question on the 4 pillars, because it's the critical aspect of this presentation.
Let me check on the chat whether we have any question. Maybe if we from the chat there's no question, but maybe from the participants, if there is any question so far, I think at this point let us know if you are able to unmute. Please go ahead and ask the question.
Okay. All right. So there being no other question, let me see if I can reshare my presentation. So 1 minute.
Also, Daniel, I think a number of people have said they are unable to register on the Google Docs, and I understand you need to have Google Docs app on your phone. So if you don't have Google Docs on your phone, you might not be able to edit. So if you're listening from a laptop, then it should be fine. But if from a phone, please, you need to download Google Doc app. And I think it's important not just for this meeting, but also for future meetings. Thank you.
Kindly resend the document. Please resend the document.
Daniel, we cannot.
We
Can you
can't
hear me
hear
now?
anything.
Can you hear me now?
Yes, now we can hear you now.
Okay. Yes, so we were talking about limitations, and nobody asked any question. And John, have people been able to register?
Yes, Daniel. The thing is,
The
if
question you
someone
asked,
is
Daniel.
joining from a phone, to register, they need to download Google Doc app on the phone. Otherwise, you won't be able to edit the document I have shared. But on a laptop, it should be fine.
Okay. All right. So then let's continue. This is just another emphasis on the pillars about the response. And remember, it is a response. If you want to take this approach, and will encourage you to, is that first you identify the problem, and then you briefly state and its magnitude, and of course, if there is data supporting whatever you're talking about, then you state that. Then you judge whether that is problem actually somebody is doing anything about it and with what effect. And if somebody is doing something about it, it is that something that they're doing about it that you make the main focus. And then, of course, you look for the evidence, as we said, then describe it in details how it is done, and then tell us what the limitations of that is all about, and you will see why it is important to do that. So I said we will also talk about what solutions journalism is not. For example, as Chris Omundi will tell you, it is not about hero worship. It's not about Otunge helping a colleague. Or an engineer, like this particular story you're seeing of see that kind of headline, for example, put the focus on the engineer and not the repurposing. So this is actually kind of hero worshipping the engineer and not the issue, that the response that the story is supposed to be focusing. So if it was about the repurposing of the energy of the used batteries to contribute to sustainable energy solutions, then that make it a solution story. So please, when you're writing these stories, look at the angle that you are taking. Do not focus on the people that are offering the solution, say the NGOs or government department or an international organization or a company, but focus on the issue. Because if you don't do that, you'll be bordering on actually public relations and not journalism as we know it. And then at the same time, solution journalism is not about silver bullet issues. Like there's one particular response or solutions to an issue, and then you present it, you talk about it as if, talk about in your story as if it is the only one. That the moment you take up this or you adopt this, then you've dealt with all your problems. No, that is not the focus of solutions journalism. You give it as one of the potential solutions that needs to be tried, and you give reasons why it should, because maybe it's already working somewhere, or has worked somewhere, or is working somewhere with some very good results, and that is what would make it a suitable solution journalism story. And then it's also not about activism or a public relations exercise. For example, if I donate some 2 shillings or 100 shillings for flood victims in Kano, when that lady who used to say serikali saidia, and then I raise some money and help a few people, that really is not something that you should focus on as a solution story, because it is not. It's more or less would result into a PR for me for making that particular donation, as we had said. And it's also not about a theory or an idea. Solution journalism is not about a theory or an idea. It is not something that you imagine, or it's not something that somebody imagines. And policymakers sometimes are very good at this. When you go to interview them about an issue, for example, road safety issues in Kenya, if you go to the National Road Safety Authority and start asking them what they are doing or what they would like to do, or what they are doing about the crashes to reduce the number of deaths on the road, because that is the aim, WHO, for example, reduce the number of deaths. Then they will start telling you about the strategic plans that they have developed and how good it is. And they even give you copies or give you links to it. That does not qualify as a solution story, because it's still more or less an idea. It is a plan. A plan is not something that has happened. A plan cannot give you facts about how it performed in the lives of the people solving the problem. So it is not an idea. And again, another problem we normally face with when we start to work with journalists on solutions stories, so some people will pitch. I think it's Chris who talked about the pitching process. Somebody will pitch something that is in their head. It is me, Otunge, who is offering a suggestion. And I want to present that as a solution story. No, it is not. So please look for concrete responses that are already solving or helping to partly solve community social problems. And social problems can be anything, can be environmental, can be health, can be road issues, can be climate change, can be economic issues, can be politics, and you offering a response to that particular problem. Offering in the sense that you share information about what is already happening to deal with that particular, not what you think. Okay. Nairobi Philanthropy revives hearing impaired. See, this is what I was talking about. A small thing, a small token somebody offers, and you want to make that a big story that you want to share globally with your audiences as a solution story. It's not a fluff. It is solution journalism, as we said, is rigorous evidence-based reporting on responses to social problems. And then again, it's also not an afterthought. It's not an afterthought. It's not you, and this comes in this way. You know about an issue, a problem like what is before you there about the open prisons in Finland. And somebody will write the story, almost cover the introduction, cover the body, and then towards the end, the conclusion is when this person throws in a word or two about a potential solution or a response to that particular problem. That does not qualify to be a fully fledged solution journalism story. Because remember, we said the focus of a solution story is the response. And therefore, that response that you put at the end is what you need to focusing on in the body of the story. So we have talked about that. It's just to emphasize that solutions journalism, it is not solution journalism if we don't overclaim or try to predict the future. So if you don't do that, then it becomes a solutions story. It will be a solution story if you show that there are other ways. It's not a silver bullet. There are other ways. It's not the only way. Then it will also be important if you make the story not about an idea, but you give the full picture, the insight in terms of how it is it done, so that others can also learn from it. And then it will also not be a public relations exercise if you provide the limitations. In most PR pieces that we get as editors or journalists, you see that the challenges that are there in the solution are not presented. You only get the positive aspects. But you as a journalist who is following the rigors of journalism will find out that in your own way and bring it into the story so that it's not a PR path, so to speak. There's an exercise, but given this, the way the webinar is, I don't think we can be able to do it now. So I will pass that and pass the break. But if you have a question, please ask before we proceed. But I want to now move to why it is important to transition from conventional journalism to solution journalism. I've alluded to it at the beginning, but let's now see, focus on it a little bit more. So it is important because solution journalism is good journalism. It makes stories stronger, tells the whole story, and strengthens accountability. By investigating problems right in front of us, a problem seen as intractable becomes acceptable. And this is the whole issue about giving your audiences hope. During the pandemic, especially COVID, if all your media houses were all about how bad this thing is, how people are dying, the number of people are dying, how helpless people were, this would not actually help anybody. Same thing when you talk about now crashes, for example, the road safety issues. If all you report is about the number of people who have died in Tharaka-Nithi, that river, number of people have died in Kampania, number of people have died in Sachawan or Salga area, and many other so-called accident or road crash black spots. I think we call them accident black spots. If that is all that we write about, and we don't go deep like our colleagues say, to look at the human angle, to look at the economic costs, to look at the health costs, to look at the challenges that the families that are left behind go through, the economic impact on their livelihoods, then you will not be doing good service to your audiences, and therefore they will run away from you. And it's even worse now because such kind of story can be told by anybody. So long as you have a phone and you can take pictures and you can count, you can be able to report on such a thing. And you will interview people like they always do on the so-called eyewitnesses, who will tell you, some of them even claim that the driver was either speeding, which is about blaming the driver. I think somebody mentioned that. Yet, if you look deeply, talking to professionals, they will tell you different things. So solution journalism focusing on what needs to be done about the overpasses, about the so-called zebra crossings, about how the road infrastructure is, about the walkways, so that about the driver, what needs to be done in terms of training, who is doing what in terms of training that helps in preventing. And I think Emily talked about that by saying, how can we prioritize writing road safety stories that would help prevent, because prevention is more important in such matters. And SOJU, solution journalism, can help us in bringing that into our stories. And then it also brings about accountability. How county government resolve the rollout. This is a story that was done by one of the journalists that we were working with, Radio Rama, and I think the writer is actually in this meeting. And this story really raised a lot of interest from policymakers because it was talking about something that is affecting a number of areas in the coast region. And when the different counties heard about what was happening, their people demanded, and therefore they started seeing what to do about it, and they adopted this thing. So your story can help policymakers also make very strategic decisions that can help solve those social problems that people are facing. And that's what people want in the stories that they interact with. A good example that we always use, unfortunately, is the US. It's about lead contamination in the United States. Some states seriously actually face this, and the water that they have you cannot even drink or use. And they try to deal with this problem. So different states, state was trying to deal with the lead problem year in, year out, putting in investment, but it ended up in down the drain, so to speak. But the journalists, after learning more about the solution journalism approach, went to another state, another city that was dealing with the same problems, and documented blow by blow what that city did, and published the story in their own city, and of course targeting the city fathers and mothers, so to speak. And that actually changed or informed this the city that was facing this problem of lead control, and they adopted this, went there, did what is called the benchmarking, like we do here in Kenya. This one is free. They came back and implemented same things, and the problem was solved. So you can see your power of your pen if you use an approach that is not adversarial to the policymakers, for example. You can partner and be able to inform and even influence policy through solutions approach to reporting. And also, it also makes the story complete, because if you write about an issue, just talk about the problem, you want to reflect society to yourself because you're part of the society, without telling the people that yes, there's this problem, but this problem is also being dealt with like this. It means your story is incomplete. And solution journalism also is important in terms of promoting engagement with the community and going deep into the community to find out how are they dealing with their problems on their own. And you'll be surprised. And a number of us actually report from within the communities because we live, we suffer the same problems. But when we write about them, when we talk about them, it's like we are not part of it. But if we just remove that cloth of traditional journalism and take the modern way of looking at the story from a full perspective, which Sojo also offers, then you will be able to see that, yes, we are facing this problem as a community, and this is what we are doing about it, and this is how it has helped us, and these are some of the gaps that need to be filled. And you shall have covered all the aspects of or the pillars, the limbs of solutions journalism. Okay. The other reason that we have seen through research, and even us here at Science Africa, is that solutions approach is also good for media bottom line. And some of you have seen the very senior editors here who are responsible even for the economic aspect of your media houses. Even if not an institution in the form of a media house, you as the eye reporter, because nowadays most of us actually depend on ourselves. We gather stories, write about them, and present them to the public. And of course, you expect to earn from it. You expect to build your name. You expect to grow as a journalist. And solutions approach is one of the ways, because in the media industry, one thing we all understand is that you actually sell the numbers. You sell the numbers. So if you don't have the numbers of people, not stones or anything else, people that are interacting with your content, then your goose is good. So how do you change the trends, the negative trends of audiences running away from what we do, our content as journalists, yet we're professionals? How do we deal with that so that we can bring them back and therefore earn from it? So it has been shown that the solutions approach leads to projects, also leads to people coming back to interact with your stories. And if you ask the journalists who have shared here, they will tell you that when they compare their solution stories, the rate of interaction or the audiences interacting with their solution stories compared to non-solutions-based stories, you find that solution-based stories attracts more readers, more viewers, and more listeners. So how is this done? I think I've talked about this at length. You look at an issue, and then you do some background research, like Chris mentioned, and Joyce and Chebet, and you can also hear the same from Wanzala, Harold, Kevin Omolo, and everybody else who has done this, Sharon and others, Gift, that you look at the social problem through background research, through talking to experts, through reading, whatever it is you do, be able to gather that information. Then you dissect it and see whether there is anything being done about it. Is this something that has been there for, and is it something being done about it? If yes, then you take the solutions approach by focusing now on that response. If no, you report it in the normal way, because by adopting solution does not mean you now don't report in the other direct way where you talk about an event or an activity or an issue that is emerging in society and therefore inform it. But if you want to educate, then you look at a problem that has been there for some time and go deep into it and pick the social approach. So that is the way you will look at issues and determine whether you can actually use the social approach or not. And there are specific questions. There are quite a number that you can ask that if you ask, because in the process of developing a story, the problem we normally face, and I've also faced it when I was active writing and looking for stories in the field, is that you go to the field, you meet your sources, you talk to them, you come back, then you realize that certain aspects of the story is not in your data that you've gathered. What do you want to run back? Maybe it becomes expensive, the person is no longer there, or things like that. But if you go armed with some of these questions and research on them, even on desk level, and then you go and ask some of these questions, keeping in mind the pillars, that you want to cover all the pillars, then by the time you come back to your desk to start piecing together the story, you will find that all the pillars, the response, the evidence, the insight, and the limitations are all here by asking these particular questions. If you master them, and we will share this, Tony will share this with you, you can be able to do solution stories very easily just by asking your interviewees these particular questions. Of course, where to find stories, as in any other kind of story that you write, if you write, do write analysis, features, and all that, most of it is through your research, academic institutions. Unfortunately, most of us journalists nowadays, we don't create rapport with experts. I don't know why. We don't have friends who are in the field that we report on, a number of us. I don't know why, but it's really critical. That's the only way you can be able to be deeply rooted in the area that you report on. So you need to have friends within the academy. Nairobi alone has so many universities, so many research institutions. In fact, they say it is a melting pot of science research and development issues. You can get all sorts of information, whether you need it from the United Nations, the universities, the agricultural research institutions, environmental institutions. You can get all of them from Nairobi. But you need to have friends that you can among the experts. Then you need to be able to look at data, and you can learn how to data and use it properly in your story. I think there are lessons you can learn at even Science Africa sometimes do training on use of data in their stories. Then people involved in the implementation of that particular response, and of course the beneficiaries. Then people involved in the problem. These are now the grassroots people, the people who are experiencing the problem. The networks of innovators, people are thinking about this in terms of what can be done about it, and are doing something. Then, of course, the program officers in foundations, a number of which deal with that particular area. It is about, because when we started working with WHO in the road safety area, I realized that so many organizations, foundations, international organizations, local advocacy groups, individuals that are doing so much about the road safety issues. But it's just that we, the media, do not focus on what they do. So if we cultivate relationship with them, if we know who they are, where they are, what they do, then we can be able to do very good stories that are beyond the crash. Crash is just like an event, but the aftermath of the crash, if you dare to look, you will be shocked. And I'm sure some of you have also, because most of us actually know somebody who has been affected by a road problem. Then, of course, there is the Solutions Tracker, which at Science Africa, but Solution Journalism Network has what is called the Solution Tracker in their website that you'll be able to show you. In fact, they are here. So you can look at this and you can get story ideas, you can get stories that have already been written and see how they are actually done. There's also the constructive journalism, which is based in Netherlands. that also has a lot of information in that area. Okay. So thank you very much. I want to stop there and call for questions, comments from colleagues who have done this. You can also share it as we also wait for Matt to come and also share with us about the WHO trends and thoughts around road safety issues, what the media can do, and how they partner with the media to help improve on this area. Okay, thank you.
Thank you so much, Daniel, for this extremely informative session, even from some of us who had trained on solutions journalism before. And I think this is on top of road safety. This is one area I think many of us, we need either fresh training or refresher training. Yeah, so at this point, I want to ask questions from presentation that Daniel has shared. If we have any question, please feel free to unmute yourself and then or reaction, and then you can ask. Also, if you're unable to unmute, also you can share your question on chat box, and then I will read it out for you. And also, I see the slides have been shared on the chat box. So that also is a very important resource. Please feel free to download. Yeah, so questions, please, or reaction or comments.
Yeah, John, this is Emily, Citizen TV. But I just want to appreciate what Daniel has been presenting. It's very useful, and also just to remind ourselves, because I know reporters and also journalists in general are very busy, and sometimes you focus on one line and you forget that there is also an important aspect when it comes to road safety and also reporting on crashes. And so I think from here we can actually just go look for the people who are involved in those crashes and I don't know, we can call them survivors or the victims, because again, if you sometimes I'm very hesitant using the word victim, because it means there was someone involved. And again, we've said we should stop blaming or blame games. But the presentation has been very useful. So thank you so much for this, and let's keep talking about road safety. Thank you, John.
Thank you, Emily. John, if you allow me, may I ask, is Kevin Omolo on the call or in the meeting?
Yes, he is.
Kevin. Hi, Kevin. I can see Javan's hand is up. Javan, hello, please go ahead.
Thank you very much for the time. I don't know, can somebody hear me?
Yes, we can hear you clearly.
Yeah, I attended the meeting with Ken staff. They talked about issue about the installation of the CCTV. Are you getting me? Are you getting me, please?
Yes, you're getting you.
Yeah, okay. I was talking about the installation of CCTVs along the highways. I attended one of the meetings with again the Kura staffs. They talked about installing CCTVs along the highways. How can we, as journalists, push them or help them to fast track these activities so that it can help in capturing the events that take place along the highways? I think this one again will help us to get the first-hand information about the accident, whatever thing which has happened on the road. Because at some time you don't expect to find somebody to be a witness of the event. But being that there is a CCTV, we can get a footage of something which has happened. How can we help to push them so they can install these ones as fast as possible, so that it can help us as journalists to ease the work?
Yes, and Javan, I think that's an excellent area where you can focus the solutions lens to see how you can develop such a story, and of course also bring in the aspect of how those cameras can also be used in when it comes to issues of speed instead of the speed guns, for example, speed, so that we all know as motorists that it's not about playing games with the officers on the road, but knowing that there is something monitoring you all the time. If there is a place where it works very well, see. So there are some of the kind of stories that you can share. And then, of course, road safety also includes issues of violence on the road. You know, it's about the safety of the users, because what the UN decade of road safety, which is I think is ending in 2030, is about the safety. The focus is on the people, the safety of the road user. We have pedestrians who are knocked. We have people who are committing crimes along the road, you know. So if you have those kind of gadgets on the road, then that can help in also curbing some of those atrocities that happen on our roads. Comments? I want to hear from colleagues like Kevin. I wanted you to share your experience as a media owner. Since you adopted Sojo, how has it worked for you? Before I ask Winnie, who has also raised her hands, to also comment.
Okay, thank you very much. I hope you can hear me now.
Yes, you can hear you, Kevin.
Oh, yes. I'm Kevin Omolo. I'm managing editor for Lake Region Bulletin. We are based in Kisumu and focusing more on the Western Kenya area. So I have benefited from Sojo. I think this should be the third year. And one of the main things that we did after our newsroom benefited from Sojo is that we incorporated Sojo in all our formats. So any story that we are doing, we try to look at, do we have a Sojo angle to it? If there isn't, then how do we find a way of avoiding just exposing problems, the challenges, and stopping at that? So if it doesn't have benefited from.
Okay, go ahead.
Our newsroom benefited from the training, the latest newsroom mentorship, where three writers, including me as the editor, were trained. And even currently, there is the one on health writing, health Sojo story project that is ongoing, that I have also benefited as an individual. So I think it's something that is necessary for newsrooms, because research after research continue to indicate that media is continuously traumatizing audiences. And the best we can do as journalists is try to reduce the trauma by telling stories that show hope, stories that are changing lives, stories that can show people that despite every negativity that we meet out there, there is some shreds of positivity that can impact on people's lives. So I wasn't part of the cohort that participated in the road safety, but I followed it up, and I know it's something that is beneficial to many of us as journalists because we interact with the roads, we use the roads, and we have been reporting mostly on crashes, giving greasy images and worrying statistics on how deaths are happening on the roads, but we fail to find what is happening to slay this drag on road carnage. Currently, we are heading towards Christmas, and this is the season for Kenya to report road carnages, and you'll be seeing November, December towards Christmas, lots and lots of accidents. But then there is also a lot of interventions that are happening. So if we could look at maybe a story of a crash, instead of exposing all the images, all the figures, we could ask what could have been done to avoid the crash, or what was done which worked in an area. So thank you very much, Daniel, and the Sans Africa team. I hope that is what I have to share for now.
Yeah, thank you. And thank you for the reminder that we are approaching the festive season when most crashes actually happen, because people are rushing, people are in celebratory moods, and therefore we are a little as driver, a little careless, and so crashes do happen to a level where some people actually even attribute voodoo or certain myths to certain parts of the road, of people seeing ghosts, things like that. But it is up to the media to be able to bring some sanity in terms of reporting on this, and so that we can avoid the deaths, the unnecessary deaths on the road, the carnage that you are talking about, Kevin. So thank you very much for sharing your experience in that, and hope that you'll be looking at these road crashes from a health perspective, because it's a health issue. That's why WHO has a whole division just focusing on that, because it's a major health challenge to the global community. And the unfortunate thing that we need to emphasize is that it is only in Africa where the road deaths are increasing. In all other areas, it's decreasing. So what can we do? How can we help, like all of you have said, to get the authorities and ourselves as road users to do something that will help in reversing this negative trend? The current World Health Organization report on road safety for Africa and global shows statistics that are really worrying for especially Africa and the developing countries. So it's up to us as the journalists to also see what contribution can we make from our educational function responsibility. What can we do? Information and education responsibility. So thanks. I see Winnie's hands. Winnie, go ahead.
Okay, thank you, sir. My name is Winnie Kamau from Talk Africa, and I'm really grateful for this session. Thank you to Sans Africa for enlightening us. I'm sorry, I don't think we've been part of your cohort, but we would like to think maybe we can be able to partner along the way because even at Talk Africa, we didn't know that we were doing solution. Part of our project was solution journalism, because we do development and human interest stories, just to be able to capture what's going on and giving a different lens. And now you talk about solution journalism, then now you're like, and we've been part of this journey. It's only that we didn't know that we were part of the solution journalism journey. But for me, what I'm thinking is, and that would form the basis of my question is, right now, if you go to many hospitals, you'll find there's a ward, especially for boda guys. It's a solution for the hospitals, because they realize if you do the male medical ward would be filled up with guys coming from accidents from boda, and they would fill up the ward so much. So many, or especially public hospitals, many hospitals have found a solution, putting up a ward specific for boda guys. I don't know if that would be a story that would that is a solution kind of story, or it would be something that would look like we are aggravated, like what Kevin just said. We are making people more traumatized when we show them that there's a boda word for guys who have had motorbike accidents. Then the second one would be following up. There's somebody who said, talking about speed guns and having CCTV on the highways. Is it a story project that you would be willing to support us if we were to follow it up? And just getting these people, or getting to behind the cameras, just to know how they capture the CCTV footage and everything. Just get into is it the call center or the data center? It's really hard. Is it something that should hold our hands on, so that when we do such a story, we can show how technology is helping, or it's not helping the Kenyan in terms of road safety? So I don't know if that's something that you.
Thank you, Winnie. I hear you. First, Talk Africa is one of our key partners, actually, when it comes to solutions journalism. A number of stories have been published in Talk Africa by your colleagues or your correspondents like Joyce, Jimby, and the others. And then we have also worked with you directly. It's just that I think this time around, when it came to the road safety training or fellowship, I think directly we were not engaging the media houses as a media houses, but individual reporters who have actually applied to join this particular program, who are actually admitted or were accepted, and they have published wonderful stories at Talk Africa. So thank you. And I think also to your question about the CCTVs and all those things that have been installed on the road, is something that we can discuss going forward and see if there's a story that can be facilitated as a health story so that we will pursue that. And then on the ward issue about borders, this is a manifestation of the problem. So my approach would be that when you're painting the problem, then you also look at the mere fact that there is a particular ward, which is an indication that there is a serious problem with the road users at the category of border borders. And then now, when now you want to make it a solution story, look at what is being done. So ask the question, what can be done? Like somebody asked, what can be done? Then find out what has been done so that you answer that question of what can be done. So that would make, you'll give a story that is not traumatizing to your readers. If you just talk about the word, that's still talking about more or less the problem, and it's what the hospitals are trying to cope with the high numbers. Now, can we deal with the road safety issue, which is leading to these high numbers of people or riders being forcing the hospital to dedicate a wing of the hospital for or wards for them? So the approach would be, how do you deal with the problem, or what can be done about the problem, rather than what is being done to me? Okay, so you're most welcome. We are having discussions around solutions journalism and sharing experiences.
Wonderful. Well, thanks so much for having me. And thanks to I wish I'd I wish I'd heard that you've got a recording, so I'm
Sorry,
definitely
can
going
I hear you?
Yes, Matt, we can hear you.
Yeah, we can hear you now.
Okay, sorry. So yeah, no, thanks so much for having me, and I will make sure to look at the recording of this later, because I'm sure you've had some really interesting discussions, and it speaks volumes about about the interest in solutions journalism and the expertise that you have in people like Daniel and the Science Africa team. So wonderful. So I'm going to talk not too long, just a little while, a little bit of a refresher from the training that was held in July. So just let me share my screen. Oh, I think host has disabled screen sharing. Can you allow me to share? Okay, wonderful. Thank you. Okay, can everyone see the slide?
Yes, we can.
Yeah.
Can see it. I hope the others.
Yes, we can see.
Wonderful, thank you. I mean, feel free to interrupt me whenever you want, or if colleagues see any important messages in the chat that I don't see because I'm looking at the slides, please feel free to just jump in and tell me. This is really just, it's designed to complement all the wonderful and insightful information that Daniel and others have shared on solutions journalism, and no doubt you as master storytellers and as professional journalists have all shared already in your discussions. It's just designed to help you a little bit more. And it's just about how small editorial changes can have a big impact on how road safety related stories and stories you write about crashes can influence opinion based on extensive studies and academic evidence. So just from the big picture, I know you will have covered a lot of this already, so I won't go on about it too long, but this is the dominant narrative that we see. Not, in many countries all over the world, from Europe to Southeast Asia to different parts of Africa, it's quite universal. So road accidents, obviously we know that term implies something you can't avoid. Road accidents are inevitable. Road deaths are implicitly and actively seen as the price for countries getting richer and for societies becoming better off. Road crashes are isolated events with unique causes. Specifically, a lot of the time what we see is that individuals like drivers or pedestrians or boda riders or whoever it may be, are blamed. And then the victims, the people who get caught up in crashes, are often the focus of the news reports, and which are often just based on things like police reports, which are police reports are obviously extremely important, but they're often seeking to explain the causes and assign, and from that we get the assignment of blame for specific road users. So that's the dominant narrative, but that's out of date, and it's wrong. What WHO is obviously trying to do by working with wonderful partners like Science Africa is to switch that narrative around and help journalists dig deeper into the causes and the solutions around road deaths, which are preventable, right? Humans will always make mistakes. I don't think we can avoid that, but with good planning, with good laws and regulations that are rooted in science, we can stop fatal crashes from happening. We can reduce the force down to a level that doesn't kill you, that the human body can withstand. And so infrastructure and the road designs and the laws and the regulations are key to managing those behaviors and things like how fast people travel and which routes they take and things like that. So as we all know, you as professional journalists can dig deeper into these causes and the knock-on effects of crashes. And transport systems as a whole, by putting safety as their priority, as opposed to quickly and efficiently getting cars from one point to another as their priority, can lead to many more lives saved. So it's flipping the narrative, essentially. And this is just a simple quote from a good book that tells this story quite well. And it just says, let's say somebody is killed crossing a busy road. It's easy to blame them, right? But what if the nearest crossing is over a mile away? Obviously, in that case, it makes sense for the person to try and cross that busy road because they've got no real other option. But then, people look at, people like traffic engineers and others planning our transport systems. They look at the data, or they look at police reports or news reports that have, or other sources that have said that the pedestrian is to blame, and they blame the victim because they shouldn't have crossed. Obviously, if the infrastructure was there, they probably wouldn't have done it, or they're far likely less to do it, likely less to have crossed. And so the infrastructure has a big impact on the choices we make and the way we behave, and ultimately how many people get hit and killed. So obviously I work for WHO, so I need to just give you some big picture points that will help you as background in your road safety and related reporting as professional journalists. And these are just the key points, and I'll give you some more detailed links at the end. I'll share them in the chat. So obviously what we have now, as I said, is these transport systems in Africa and all over the world that are still designed to move cars from A to B, but clearly they are unsustainable, and clearly they come with a cost in human deaths. Which is not acceptable. And so, as I said, and we all know as well that there are huge environmental and social knock-on effects from road crashes as well. And so what WHO is trying to do is advocate for and support countries in building out transport systems with safety and sustainability at their core. So that means putting in the infrastructure, the pathways so people can walk by the sides of the road safely. In countries where people use bicycles a lot, making sure there's bicycle lanes, things like that. And obviously encouraging and putting the infrastructure in place to encourage those things more safely will encourage more people to do it. And especially in many African countries where people walk a lot. They need to, a simple thing like putting adequate pathways there is absolutely key. So, as I said, reporting, you as professional master storytellers and professional journalists and truth diggers and tellers will have a much better understanding of this than me. But what I know from the studies I've read is that, as I said, small editorial changes, small ways, small changes to the way you write up these reports or the way your editors edit these reports can make a big difference in terms of how people receive them and ultimately influence policy better, in the sense that it will encourage policymakers to use the approach to building transport systems that has a focus on safety and sustainability, not on moving cars from A to B, that comes with a cost in human lives. So here are some small editorial changes that we know through decent, rigorous studies make an impact on how readers or watchers or viewers receive reports from journalists on road crashes. So I'm sure you've heard this a million times already, so I'm sorry, but use crash or collision, don't use the word accident. And I know that there's possibly a need for WHO and others to work with editors to encourage them to adopt specific editorial policies on things like this. But don't use the word accident. In terms of the way you frame crash reports, obviously, provide a bit of context. So if you're talking about, a crash involving, a boda rider and a van or a bus in some traffic black spot, obviously, you can find out from the National Transport and Safety Authority or other authorities how many fatal crashes have taken place there in the last year or the last two. So you can provide a bit more context to show that these, to link to the fact that sometimes the way that the road designs and the infrastructure is designed leads to these crashes, as opposed to just things like drink driving, which do cause crashes. But it's about looking deeper than these individual behaviors by individual road users like drivers and looking at the system, right? So another small editorial change, I've put here counterfactual statements. I mean, I took that from an academic study and I wasn't even sure what it meant myself. But the example here is quite clear. It's like if you put in individual facts to add a bit of color or humanity or detail to your story to bring it to life a little bit, that can contribute to victim blaming if you're not careful. So for example, the quote I've got here is that the pedestrian was dressed in dark colors. Now, obviously, if you're talking about a crash story at night or something, the implication from that is that they shouldn't have been wearing dark colors, and that's why the driver couldn't see them, and that's why they got killed. And there's obviously some truth in that, but there's much more to it than that as well, probably, if you dig a little deeper into the circumstances that have occurred and speak to a few more witnesses or a few more experts to give you background. So again, this focus on victims. The way you frame your sentences, if you put the emphasis solely on the victim consistently, these studies that I mentioned have shown that does increase victim blaming. So there's ways of framing the way you write, not specifically around the victim, and I'll share some links, as I said, to examples of that at the end. You will all know this as master storytellers, as I said, and professional journalists. But obviously, in digging deeper and finding and sort of and understanding the deeper root causes and the systemic causes of these crashes and the solutions, as Daniel's been talking about, you can talk to communities, relatives, and experts who have been affected in different ways. And so there's plenty of opportunities to dig a little deeper and find those systemic causes of crashes to help sort of flip the narrative and call for governments to do a better job in terms of putting safety first. So there's just a few simple two more simple quotes that you know, add a little bit of life and color to these quite academic points that I'm making. And the first one is from an expert who studied, studied and done a lot of research on how narratives around road crashes and transport, you know, reflect and influence public opinion. It is unimaginable that we present rape victims in what clothes they were wearing or what they were doing when they were attacked. This focus on victims makes us ask questions about them rather than the systems that they are operating in. Obviously, he's deliberately being a bit provocative by bringing up, you know, by giving the example of rape, but he makes a point quite clearly to dig deeper and look at the systems and the context of what's happening. The second, and that's from a professor in Amsterdam, University of Amsterdam. The second quote: when someone dies in a crash, an average of 11 family members, 4 close friends, 56 friends or acquaintances, and 42 emergency workers are all permanently affected. Now, this is a quote from Germany's former transport minister. You know, it's not from WHO, and nor is the first one, but it serves to illustrate the point just how wide-ranging the knock-on effects are of individual road crashes on families, on communities, on you know, the World Bank estimates that in many low and middle income countries, in many developing countries, GDP is knocked back by 3% due to the massive extent of road crashes and road trauma that we see, which is preventable, as I said. So, you know, this sort of sums it up, and you'll have heard this before from Daniel as an expert master trainer in solutions journalism and journalism as a whole. But WHO has a number of resources, again, that I will share with you in the chat at the end of this. And one of them is a guide on reporting on road safety. This guide is, you can just Google it, WHO reporting on road safety. I'll share the link again at the end. But this gives you a whole range of different story ideas, and it's written, you know, by journalists, by editors, for journalists, for editors, from many different parts of the world. And one of the you know, we produced this with the Pulitzer Center for Crisis Reporting. So the former senior editor from there said, as a journalist, you have the opportunity to put this crisis in its proper perspective, to educate your audience, to raise awareness, and to influence decisions. You must dig beneath the numbers to understand the complex interplay of factors that lead to a road traffic fatality. And as Daniel has explained, so no doubt so well, you know, what the questions are: what has worked and what hasn't worked from different countries and places in terms of reducing road deaths, to provide solutions. And I'm sure Daniel will have also have mentioned that, you know, obviously it's your job as journalists to hold power to account and hold leaders to account. But I think Daniel mentions a number of times as well that policymakers tend to receive these solutions-focused stories, you know, quite well, and in some cases better than the sort of hard newsy, heavily critical stories, which are extremely important. And I'm not suggesting as journalists and the crucial role that you have to play in holding power to account shouldn't do that. But if you show them stuff that works, you're more likely to inspire them into picking up the phone and speaking to someone else about it. So that's the point. So again, getting into the resources, for Kenya, or for every country in Africa, and nearly every country on Earth, we have fact sheets on WHO estimated road deaths, the state of the laws and the regulations and the rules that you have in terms of WHO and UN recommendations. And all of that is available at your fingertips on the Road Safety Data app, which is on the Apple Play and the Google Play Store. And it's also on our website if you don't want to use the app. So I'll provide a link to that. So that's all potentially all useful background if you wanted to compare, compare the number of road deaths in Kenya with Uganda or Rwanda or Ethiopia or anywhere else, or for Africa as a whole. So these are some of the resources. I will put the links in the chat in a minute. Daniel will have mentioned, the Solutions Journalism Sojo Story Tracker, and I know that some of you have already put stories in there, if I'm not mistaken. There's a number of road safety stories in there that are exemplary. We have, as WHO, a microsite for this project on road safety reporting with a whole load of training resources there. And there are some X or Twitter handles there listed on the page that you can follow, where I put out resources and stories. And I will put a link in the chat in a minute to where you can sign up for newsletters. And in those newsletters, this is not just WHO promotional guff. We deliberately, we go online and speak to partners and provide you with and pull together the free training resources for journalists and that are useful. So from the Reuters, from Thomson Reuters Foundation, from AFP Fact Check, for example, or others, from the International Centre for Journalists, Solutions Journalism Network. So we try to make those studies and training materials available, because it's our job to help you to be able to dig deeper into road safety stories in order to push for more change so we can avoid needless deaths. And that's it from me. So happy to take any questions or constructive criticism or anything else you want to say. And thanks very much. I'll put the links in the chat in a minute.
Thank you, Matt. John, over to you.
Thank you, Daniel, and thank you very much, Matt, also for the resources that you're sharing also on the chat, and also for the presentation. It's always a pleasure to hear from both of you, especially on this topic on solutions journalism and road safety. Yeah, so at this point, any question? I think Matt is still around. You can take a few questions as we come to the end of the webinar. So a few questions or reactions, please feel free to unmute, or you can also type on the chat and then I will read it out.
Hello.
Yeah,
Good
feel free
morning.
to jump in. Oh, sorry.
Hello, are you getting me?
Yep.
Thank you. My name is James from the Standard newspaper, James Wanzala, and I'm passionate about road safety reporting. First of all, I want to thank Science Africa for this opportunity, and also WHO. And I'm sorry I had some issues with settings on my mic. That's why I couldn't give my experience. But I was requesting, Daniel, if possible, you can allow me to give my experience and some comments from what has been presented.
John, is that okay?
Yeah, James is okay. Yeah, I just I think we were giving the others 10 minutes, but we'll give you less than 5 minutes. Please go ahead quickly.
Okay, thank you so much. And first of all, I also want to appreciate my colleagues who are here. Some of them my colleagues, others current, former, etc., and the many journalists I've encountered whom I didn't know that they're also road safety reporters, and I'm happy to see this. So my experience writing on road safety in Kenya is that one of the things I've observed is the lack of support from the relevant authorities, including KENHA, NTSA, etc. So imagine you have done a story highlighting an issue, like, for instance, I'm passionate about pedestrian safety. And you do a story about how footbridges have become marketplaces, like my colleague, my friend Chebet mentioned. You know, you expect after that something will happen. But imagine after 1 or 2 months, the situation is the same. Now, whom do we blame in that position? I think it's these authorities. They should take action, because the joy of a journalist is when you do a story and maybe 2-3 days later, you go there and find that there has change that has happened. It's a big joy to the journalist. But if you go there and find the same situation, you feel discouraged, demotivated, that actually what I did, it seems like was not, nobody read it or saw it. So this is a challenge to the Science Africa and WHO, that if possible, you can also interact, or rather maybe have a meeting with these agencies that are supposed to effect policies, that are supposed to take action when a story has been highlighted. It will be a good thing, because it's so much discouraging doing one thing and another doing the same thing later, being the same situation, no change has been made. So that is one thing I would request, that Science Africa and WHO get involved in that. Number two is we also, as road safety reporters, need motivation. This can be like in terms of awards. Yeah. In Kenya, we have awards by Media Council of Kenya called AJEA. And I really doubt if there is any category of road safety in the categories they normally give. So I think this is a good time for Science Africa to interact with MCK, so that they can also include such a kind of award. This is a motivation to reporters who are doing road safety stories, because in the other sectors of writing, we have them. So this will be good motivation for the reporters who are doing road safety. Another thing is editorial support. In Kenya, most of the media houses, we are lacking editorial support. And one of my one of the participants mentioned about that. Getting a road safety story given a front page in Kenya, it's not an easy thing. And many of them will agree with me like that. In Kenya, we are giving focus mostly on politics, among other things, corruption in the government, among other things. But road safety is not easy. For those who are in this year's cohort, the group that we are in the recent training that we had, you saw the story of Citizen from Tanzania. It was given a front page, I think including also in Ghana. But in Kenya, you may not even see it. Do your research throughout the year. The story will be given, will be placed maybe in the middle of or inside of the story. So I think it's time also Science Africa and WHO interact with our editors, our bosses, that it's time also we give road safety prominence, like the way we are giving other issues. So that is something I'm requesting, because sometimes even you have to push for a story to be used, and it takes very long until sometimes you even get discouraged. It's only recently that now newsrooms are a bit taking seriously road accident, but not that seriousness that it deserves. So we are requesting that there is a dialogue between you two and our editors, so that we are given also prominence. Another thing is in Kenya, we're also lacking updated data that is useful in reporting. Recently, I was asking NTSA, do we have the recent statistics for crashes? And he told me it's hard to get for the recent. He was giving me, I think, July statistics. You know, they normally give frequent statistics about crashes, like maybe for the whole month, etc. But when I asked recently from NTSA, the guy told me, he gave me, I think in July. So you see, so we need that information to be available, and not only be available, but also updated to the current status. Finally, I would say that I think it's also good that I want to thank Science Africa for the issue of Sojo. Initially, I'm one of the people who do stories that are not Sojo-like, maybe accident reports, statistics, etc. But after the training, I am now changing the way I do stories. And it's a good way that all road safety reporters know what is Sojo. There's a story I shared recently on a group that we are in about where it says Mombasa General Hospital, Coast Hospital, reporting 750, I think, crashes every month. I read through the story, and unfortunately, I didn't. It was done by our colleague from Mombasa, and I didn't get the Sojo angle in it. What I expected is that what is the cause of this incidents, or rather crashes, or other reports that are recorded, victims. What are the cause of these victims? But I didn't get that in the story. What about if this journalist had gone through the Sojo class? I'm sure he could have said what is the cause, because I didn't see that. Could it be that in Mombasa, many people are not using pedestrian footbridges that are there, maybe, or there must be a reason, which I didn't get in the story. So this Sojo training through South Africa and WHO has really enlightened those who have passed through it, and we encourage to have it more and more. And another thing is that
the last thing, James,
I would like to request. Yes, finally, I would like to request. I have seen many journalists here who are my friends, some of them, but I think it's good if we can come up with maybe a group of Kenya road safety reporters, because through that we might share story links, we might share ideas of opportunities among other beneficial materials that can be useful to us. Thanks a lot.
Thank you very much, James, and welcome back. I know you had challenges in the beginning, you couldn't share your experience. Yeah, but thank you very much for that insightful experience. So back to you, Matt. There's some questions on the chat. I don't know, I could read them to you. The first one is from John Sam Okoth. He's asking, sorry.
Yeah, I saw that.
Yeah, I was asking, it says, Mr. Taylor, I was asking, what if we include NTSA in this issue? My reason is that he didn't complete the question.
It's a bit further down. It says, the reason is they provide rules and lessons for drivers.
Yes.
So what if we include, yeah, I mean, absolutely. NTSA, if I understand correctly, NTSA is the primary authority for road safety in Kenya, right? So clearly they, you can speak to them, you can ask them questions and speak to them. And I mean, from my understanding, their communications and press relations team are quite open. I can't speak for NTSA, of course, but as Kenya's primary agency on traffic safety, I mean, absolutely speak to them. I think for the last training we did with Science Africa on road safety reporting a couple of years ago, and in the one in July as well, they worked. They showed the participating reporters a number of infrastructure improvements that are happening. But of course, it's your job as journalists to hold them to account, right? And to compare and contrast the facts that are shared with other relevant, governments or regions or states or whatever it may be. So look, I'm not sure I fully understand the question, but clearly NTSA will be able to help you with road safety reporting, whether it's on numbers of fatalities, whether it's on infrastructure plans, on traffic safety plans overall for specific areas, all those sorts of things. So I mean, John, Johnson, did you want to just jump, if you want to ask if I've not understood correctly, feel free to turn your mic on and let us know if we've missed anything in the answer.
Yeah, thank you, Matt. John, do you want to clarify your question? Then also we have 5 minutes. Yeah, please go ahead.
Okay, my question is about this road safety issues. What like NTSA is involved in providing driving lessons for these drivers, and these drivers are the mostly people involved in the accidents, and so
Johnson, we lost you. Please check your audio. I think we lost Johnson. Johnson, once you back, let me know. In the meantime, we can take another question as we wait for you. Matt, I don't know. I can't hear you. I don't know whether the others can hear you.
Yeah, I'm being stupid. My mic was muted. I'm really sorry. Thanks for letting me know. So look, I'm not sure. I'm not sure there's any other questions for me, but I see that there's one for Science Africa. No, from Alfred, or have I missed something?
Yeah, Purity, go ahead. Yeah, there's one question from Alfred Oula. Maybe I could read it out, and then Purity, you can come. You can afterwards. You can ask also a question. This question says, "Good content, Purity, good content and guidelines on solutions journalism from the speakers. I would really love to actualize road safety reporting in Kenya. After doing such stories, do they get airtime outside the country for benchmarking, or do they get consumed locally? How does Science Africa aid in that?" Yeah. And also from Javan Olo, he says, "I think it can be easier for us to have one joint WhatsApp group that we can be able to share any eventuality, not only on the road safety coverage, now that we have, now that we have list with numerous number." Sorry, I can't read. I can't see that. Yeah, this is a comment from Javan Olo. So maybe Science Africa for the question from Alfred Oula.
Okay, if I may respond briefly, once you develop your story and have it published, I think nowadays it is seen all over the world, especially if it is online.
I think if I can just add something to that. I mean, I mean, Daniel, so I'm sure will correct me if I'm wrong. Please do, Daniel. But my understanding is also that if you produce solutions focused stories, that meet that really do fit with the 4 pillars of solutions journalism and the strict criteria of what constitutes solutions journalism. So as you've heard, it's not hype or advocacy. This is rigorous, impartial reporting that's focused on responses to problems as opposed to problems themselves, asking questions like what works, what doesn't work, and why, and where's the evidence, and what's the impact, and what are the limitations. Then you can actually put your stories, you can get your stories included on the Solutions Journalism Network story tracker, which I mentioned, and I'm sure Daniel did too. And that is global exposure through the Solutions Journalism Network. And we've seen, through the work, through WHO's work with Science Africa over the last few years, and with other partners in other parts of the world as well. Good stories that resonate with audiences across borders do spread. And we've seen one story from Ghana from a journalist who was part of the cohort from Ghana just recently, a really good story that I'll find a link to it after this and I'll put it in the chat. But that's, obviously it was through Ghana's news agency. So a lot of media outlets in Ghana use Ghana's news agency as to source content, but it also was picked up in places like Tanzania. So it does happen. And the Solutions Journalism Network provides and its various digital platforms and partners that also promote good Sojo stories will promote good Sojo stories. WHO will do the same if you produce a really decent road safety story that illuminates gaps on things like regulations, laws, infrastructure, and highlights solutions with good evidence. Will absolutely promote it. So hopefully that adds a little bit to the answer, and hopefully that's helpful. Yeah.
Yeah, thanks, Matt. So we've run over 3 minutes over. We should have ended at 11:45. But is there any one question before we finish?
I see Mercy has her hand up.
Okay, Mercy, please go ahead and unmute.
Okay, thank you. There is this issue of trucks, long truck, these transit. They're the major cause of accidents in Kenya, which I remember in July when the WHO were releasing their safety status, the status of safety. I went through their report, but I was not seeing that they're addressing this issue of trucks overtaking these small cars in our major highways. And remember back early this year, there was an accident of students from Kenyatta University, which was caused by driver was trying to overtake this train. So my suggestion, or I don't know how to call it, the issue of this truck. If WHO can include next stage they release their safety report, I think they should include this issue of trucks addressing this issue. Like they limit the number of long trucks being included in major highways. Yeah, that's nice.
Thank you, Mercy. Maybe Matt, you can take that, and alongside the question from John Sam Okoth, he has listed it on the chat, and then after that we can close.
Yeah, I'm going to be really honest, Mercy. I'm really sorry. I'm not sure I fully understood that. By tracks, do you mean rail tracks, or I wasn't quite sure. It was a bit hard for me to hear. Maybe it's my computer.
The road fracas, the road tracks.
Road tracks. Look, why don't you just? Huh? Sorry, what?
The trailers. We call them trailers here.
Oh, okay. All right. So look, I think we have, clear guidelines on infrastructure and vehicle safety and things like that. So I'm not an expert on that really technical area of work, but I can certainly, if you wanted to write down, Mercy, maybe just write down in the chat exactly what you mean, because I'm sorry I didn't hear you properly, but I can check, and I'm happy to follow up with technical colleagues who can give you a specific answer, because I'm not the expert. But look, if you do, someone put in the chat about setting up a country WhatsApp group. If you do that, I can answer questions like that in the group, and I'm more than happy to do that. Yeah.
Yeah, I think there's one last question for you, Matt, from Sam Doe on the chat. How can we expand the safety coverage to the general transport safety? We focus on road safety, yet we have issues of water transport, railway safety, and also John Samokothe has clarified his question on the chat just above that. Thank you.
Yeah. Okay. Got it. Wait.
Just lock the door then. You know.
So I think, colleagues, as Matt gets ready, you can put questions on the chat, but afterwards we finish, we can, as Matt has said, we can have the answers to the rest of
Okay.
our
Sorry.
questions on the chat. Yeah, please, Matt, go
I've got
ahead.
two. Yeah, sorry. I've got two small children at home, and they just barged in here, so I'm sorry about that. So look, I think on the first question from John Sam, yeah, mobile phone use be strengthened. Yes, there is a growing body of evidence, obviously, around distracted driving that exists out there, including mobile phone use, that shows the risks of crashes are pushed up, and there is guidelines on safer driving practices that are produced by different parts of the UN. So again, if we, if you set up a WhatsApp group, I can provide links to this stuff, or share it in the chat after that. So hopefully that answers the first question. And the second question is about general transportation safety. Yeah, absolutely. So WHO also works on things like drowning prevention. You mentioned water safety. On wider transportation safety, road safety is often compared to air travel safety because obviously air crashes are extremely rare, and you're extremely unlikely to die in an air crash. But because people feel so vulnerable when they're floating in a metal tube in the sky, safety is obviously considered to be far more important when actually it's far more dangerous to be on the road than in a plane. And in terms of, and that's used as a model for other transportation groups, whereby safety has been prioritized so well for so long, that fatalities are extremely rare. And ideally, other parts of transportation safety would follow that model. And in terms of water safety, water transport safety, yes. Again, I can provide links to this, to our work in drowning prevention and water safety. We have standards for things like how many life jackets on boats, teaching kids to swim and things like that. So there's lots of work that's already been done on that. Railway safety, not so much, but definitely on those two. I hope that answers your question.
Yeah, so thank you very much, Matt. And I think we have many questions, but I think at this point I want to get turn back to Science Africa, because we need to finish before midday as we had promised. And the questions we have will still be answered on the WhatsApp group that we will form. And I think, Matt, you can confirm we can add you to the WhatsApp group, right?
Absolutely, absolutely.
Yeah, thank you very much. Yeah, and to my colleagues, journalists, I want to thank you so much. I know it's not easy to be in a webinar for 3 hours, but we've had 100% participation from the beginning to the end. And thank you very much. The resources that have been shared on the webinar will still be shared to you on email. So thank you very much, and I hope you have registered also on the form, on the Google form that I sent. And to Matt, thank you very much also for making time to speak to us and also to answer our questions, and also to promise that you'll be at hand if we have more questions. And finally, thank you to Science Africa. We really cannot thank you enough. You have really, before you introduced these trainings, we didn't know much about road safety. We only knew about the numbers that we report every time of the number of people who have been killed on our roads. So we thank you very much, Mr. Otula, Daniel, Leo, team, and thank you. And I hand over back to you now, Daniel Otunge.
All right. Thank you so much, John, yourself, for facilitating this so wonderfully. And colleagues, thank you very much for joining. We wish we actually even had a larger capacity to even admit more. What this shows us is that there is a lot of interest, Matt, in road safety reporting. And as you have said, we will see how this interest can be harnessed so that we improve on the road safety reporting generally across Kenya. So colleagues, thank you very much. If the opportunities and if this WhatsApp group is formed through your consent, we will be able to share all the opportunities that are there so that you should be very competitive so that you can also apply. But that is not the end. We can use this forum we have for conducting further trainings, I believe, and I think that will be beneficial to all of us. And if there's anything that can benefit you and benefit us, we will share it through this platform. So we encourage you to be very active, but please, once it is formed, use it only for constructive road safety issues or transportation issues so that we maintain the hygiene of the group. Thank you very much, Matt, for helping us to talk to us about the issues and how we can improve on our language in terms of reporting on these road safety issues. And all colleagues, Mr. Tula, Leo, Tony, for facilitating the aspects of the technical part of it. We are really grateful. So thank you, colleagues. I personally think we should end it there.